Hi, welcome to Health Beat. I'm your host, Judy Marie, and today we're going to be learning about Ontario's program for dental health care for low-income seniors. And my guest today is Silvana Edenburn, and she's a dental health hygienist with the Northwestern Health Unit. Welcome to Health Beat, Silvana.
Thank you, Judy.
So you're a dental hygienist with the Northwestern Health Unit. How long have you been there?
I've been at the health unit for 13 years, but I've been a hygienist for 22 years.
Oh, so a long time in the field.
Yes,
and can you tell us a little bit about your role at the Northwestern Health Unit?
Well, what I do primarily is I lead the Healthy Smiles Ontario team. So that is a team that goes throughout the community and provides dental care. So I've been doing this for over 9 years now. So it is a mobile dental office that does outreach work and provides dental care to vulnerable families and low-income families.
So we're really reaching some people in need then through outreach with the dental program.
Absolutely.
We know that it's really important, and we talk a lot about oral hygiene and, brushing our pearly whites.
Yes.
But it's really important that we take care of our oral hygiene. Can you share with our viewers a little bit more about why that is?
Well, it's super interesting because a lot of people kind of don't put together the mouth and the overall body. So that's actually our gateway to our whole body. And so without having a healthy mouth, it affects many things. We're unable to smile if you have teeth that, don't look real nice, so your confidence is really affected. You can't eat well, so that affects your overall health as well. If you're unable to eat solid food, crunchy food, you're not getting the nutrition to have a healthy body. Also, the bacteria in your mouth, if you're not taking care of your mouth properly, will go to your heart, and that can affect your heart in different systems within your body. So often that's an overlooked piece, and it's an expensive piece that needs to be maintained. And often it's something that people might think, oh, you know what, I'm not going to take care of that because it's a lot of money. Mm-hmm. So over time, it can amount to a lot of overall health that's probably in the negative.
And do you see seniors often in the work that you do?
Well, we've been running our program for 9 years. So what's happened is we've for years and years we've had adults calling asking for help because they know that we've provided service to children for free, meaning that they qualify for the program. So we were getting calls continuously, ranging. So we only service children from 17 and up, or 17 and down, I mean. Mm-hmm. So then adults would call and say, we have a toothache, and if they didn't fall into one of our government programs, we were unable to help them. So we were always hoping for an adult portion, and so when this announcement came through, we were able to help seniors 65 years and older.
And this is just a fairly new announcement, I believe.
Absolutely. So it was announced in April that they were going to roll out this program, and then in November we were given all the tools to actually implement the program. So, over the years we've had people where they take matters into their own hands and they're actually extracting their own teeth because they can't afford it or what have you. So that for our team was heartbreaking to know that people could not access care because of the cost. Mm-hmm. And something like that could be detrimental to their health. So, and they also realize within the ministry that, this is an important piece for seniors that they get their teeth taken care of for their overall health.
So this program is now for people, is it age 65 and older?
Yes, there are qualifiers. So there's 3 main things. So it's income eligibility. So if you're a single person, you have to earn less than $19,300. If you are married, combined total is $32,300. So we help with that, and we take a look at their latest income tax return. So they have to qualify with that. They have to be a current Ontario resident, and they have to be over the age of 65. Another qualifier is that they cannot have any other form of dental insurance.
Okay, so there's 4 qualifiers
yes.
then in total for people to apply. Now, it sounds like you need to know your income from your previous year. How is that determined? Is that through income tax?
Yes. So there's a magic line. It's called line 236. That's what we tell everybody. So you look at your last income tax statement, and I think that you will get something from the Ministry of Finance that tells you what line 236, that's your net income. So if you look at that, it'll tell you right away. And that's how we just do a generalized observation to see if you may qualify. And then you come and complete the applications, and the Ministry of Finance will actually determine if you're eligible or not.
If people feel that they may qualify and they have some questions, who would be the first point of contact where they would reach out to?
Well, they could always call us or come into any local office. So we have a 1-800 number. It's 1-855-407-6453. So what happens is if they call that number, they will get us to whomever, which is normally me, and I walk them through the process. And it's been very successful. I've been able to enroll people over the phone, so then they don't have to come right into the office, and we go through all of the steps and we put it in manually or into the computer system and go from there. We've had really good success with that.
And so that's great because then it's more accessible, especially in the winter.
Absolutely.
People don't have to travel
Absolutely.
if they don't have transportation.
Oh yes, so we try to eliminate all those barriers and make it, you know, easy for seniors, because there are some people that just, you know, they're not really computer savvy. You know, they have to come into the health unit, they got to find someone to help them, or they could drive themselves, of course. But we just try to make it as easy as possible.
And it sounds like there's been a pretty good uptake so far.
Yes, well, it takes a bit of time for you to get the answer from the actual ministry. It's about a 4-week turnaround time. So we're starting to see the numbers climb because it takes time to complete the application, send it in, those sorts of things. So we're starting to see that there's good uptake.
And when people apply and they qualify, who do they see to access the service? Can they see the dentist of their choice, or are there certain dentists that are participating, and what are the options for people?
Well, it all depends on the location and where they're living. So within each community, there are different providers that are accepting the program. So we encourage people to contact us, and then we can give them the list. So let's say Kenora. So they would contact either the Kenora office, or they would reach out to me on the 1-800 number, and I would give them the list. We have the ability to just connect them right to the office over the phone to book appointments. So we try to make it as easy as possible. So in Kenora, Sioux Lookout, in all of the different areas, we have people and different options in place.
So you actually act as a system navigator to help people
That's
through the
exactly
system.
what our role is. That's exactly what we do. I kind of look at it that in my role that I want to make it as easy as possible, because I know for my parents that sometimes it gets a bit confusing, so I try to be that person that can make it as easy as possible. And often I'll even work with, if families have, you know, supports, I'll ask if I can contact their supports, so then everybody's on the same page and there's no confusion. So it's been really successful in that option.
That sounds great. I think what we'll do is now we're going to just take a short break, and then we'll come back and we'll continue our conversation.
Sounds good.
Stay tuned for more of Health Beat. We'll be right back after this short break. Welcome back to Health Beat. Today we're talking about the Ontario Seniors Dental Program for low-income seniors, and my guest today is Silvana Edenburn. She's a dental hygienist with the Northwestern Health Unit. Welcome back, Silvana.
Thank you, Judy.
Let's pick up where we left off. We were talking about the program for the province of Ontario to help out seniors with low income in their dental care. What happens once a person is actually registered? So they've contacted the health unit, the paperwork's been sent in, we find that they're approved. What happens next?
So you get notification in the mail, so it comes in a letter format. So it'll tell you, we've seen that they'll tell you qualify, that they need more information, maybe a signature is missing on the application, or something maybe isn't matching up, or they qualify. So if they qualify, they get a dental card that indicates that they're a recipient of the program. And so the coverage runs from, well, if they were to enroll right now, it will run from the moment they qualify till July 31st, 2020. And then what happens if they qualified, they will assess them internally once they put in their income for 2020. So they will assess them, and if they requalify, they'll get a new card. So the coverage goes from August 1st until July 31st. So that's how it runs.
Okay, so there's no need to apply every year then?
No. So they will notify you if you don't qualify for the consecutive year. And if the following year, like say you didn't qualify, you could reapply for 2021, I guess what it would be, because sometimes incomes, you know, fluctuate. I'm not sure that seniors' income really fluctuates because they're pretty concrete in respect to they get their pensions and their different benefits and that sort of thing. But if they do qualify for other incentives, sometimes that kind of changes some of the dynamics and where their finances actually fall into the category of becoming eligible.
As we're talking, it just sounds like they're really trying to make it as easy for people to access the program.
Well, you know, we're trying really hard at the Northwestern Health Unit, and we're trying to do everything in respect to making it pretty stress-free. So the online portal we find is the easiest. So what we do is we just take their information over the phone. So we have a bit of a conversation, talk about, you know, kind of the preliminary qualifications. Do you live in Ontario? Most people are phoning locally. Are they over the age of 65? So we're doing that, our preliminary kind of intake. And then we just go through everything over the phone and we put it into the actual application and it's submitted online. And then there's a portion that gets printed out, and they do need the actual, it's called a wet signature, which means they need the actual signature that allows the Ministry of Finance to look at their finances. So that's kind of a big portion of it. So we send that to the seniors at their home, and we also include a self-addressed envelope and postage, and they just sign. We clearly label where to sign, and they send it in the mail, and it kind of finishes the process. So to date, it's been very efficient, and everyone you know, actually the seniors are so thankful because they feel like, oh, we're getting a live person. They're actually answering us. They're helping us. And you know what? We've met a lot of lovely people over the phone, to be quite honest.
And that's a rarity these days to get an actual person when you make a phone call, because usually a lot of the systems are automated. So
Oh, and there's nothing more annoying.
I know. Once somebody's approved, what type of services can they get through this program for dental care?
Well, they can get a regular checkup, they can get cleanings, they can get x-rays, they can get fillings, extractions, root canals, and if they need dentures, that is also covered as well.
Wow, so it's a pretty comprehensive program, it sounds like.
Absolutely. The only thing that isn't covered is actual implants, and that's a very expensive piece to it all. But other than that, it's pretty comprehensive, and it includes regular dental care. So it's not just a one-time. So then you go to your dental office regularly to keep your oral hygiene in check, and you know, and if anything arises from the preliminary examination and you need more fillings or whatever the case is, that's all covered.
Well, I know I go every 2 months to get my teeth cleaned, so would that be something that would be covered as well?
Yes, yeah, yep, absolutely.
So a prevention.
Exactly. So the prevention piece and the treatment piece.
With this program, has there been any additional funding from the province of Ontario to help support the program?
Well, yeah, actually, yes, there has been. I was kind of perplexed in the question, but I know exactly where you're going with this. Yes. So we're going to be doing some upgrades to our fixed clinic. So we've been operating our program for 9 years with an existing infrastructure of a mobile dental office. But we also have fixed clinics in Ignace and in Pickle Lake. So they have it's just like it's a dental clinic, and it has 2 operatories where we provide service. So we're actually getting upgrades to our equipment. That's what we got funding for. So that's very exciting. We're going to get new x-ray units and upgrades to our dental chairs. So that will be there. We're also looking at doing an expansion in Dryden. We currently have an office that just provides preventive services. So we're going to do an expansion where we're going to have a fixed clinic there as well, which means that we can take x-rays, we can do dental treatment, and the whole group of things that we can do. So that's another exciting venture. And then we're getting another mobile dental office. So that's very exciting.
I'm interested in the mobile dental office. Now that intrigues me. What is a mobile dental office?
Well, it's actually a dental office on wheels. So it has everything from a waiting room, it has a sterilization area, it has a treatment facility. So from front to back is actually just a whole dental office. So all the services that we talked about, we can provide on that mobile dental office. So it's kind of a dental office on wheels. We call it our Smile Mobile.
Would this be like in a bus or?
It's actually a Winnebago. So yes. So it's 33 feet long.
Wow.
So we can't just pull it up just to anywhere. We've got to kind of assess the situation and make sure that we're able to park. It's self-sufficient though. So meaning that it will run off a generator, and then we can just pull up, drop down the jacks, and work away.
And would this bus be accessible?
Absolutely. That's one of the really great things about it. It has wheelchair accessibility. So our vision in the future, with our new mobile and our existing mobile, is once we have enough people enrolled and we find that there's kind of a cluster of people, meaning maybe a long-term facility or different locations where there's supportive housing, let's say, we would find, say there's 8 seniors that qualify, instead of them having to go to a location, we will come to them. So we'll bring the mobile right up to the door, book the appointments, and if wheelchair is an issue or they may have mobility issues, we have the lift to bring them in.
That's fantastic. It's really reaching out to public and to people in need.
Absolutely.
And helping break down some of those barriers.
Yes.
For accessibility, for transportation. My one question is, who drives this big Winnebago?
Well, I do. And sometimes I kind of driving along and I think, wow, who would have ever thought? So we do have people that drive. It's both of our health educators that drive, as well as myself. So no special license is needed. You just have to be trained to drive it because it's big. It's big, but it becomes kind of just like driving a car after a while. You just have to be mindful of the length of it when you're turning, those sorts of things. But we have enough I guess, time and hours logged in that it just becomes second nature.
Okay, we're going to take a short break and we'll continue our discussions. This is really interesting.
Sounds good.
Stay tuned for more of Health Beat after this short break. Welcome back to Health Beat. Today we're learning more about Ontario's new program for dental health care for seniors with low income. And my guest today is Silvana Edenburn, and she's a dental hygienist with the Northwestern Health Unit. Welcome back, Silvana.
Thank you, Judy.
We left off, we were talking about accessibility and with the program and with the bus, and this thought keeps going around in my head. The wheels on the bus go round and round. So maybe you could tell us a little bit about how many miles you've put on the bus or where the bus goes to?
Well, the bus goes to wherever the need is generally. So year to year that fluctuates. So we go anywhere from 8 to 10 communities per year. So we go primarily in Fort Frances. There's a real high need there. So we go there for an extended period of time, usually over the course of the summer. But we have gone as far as Sabaskong, Lac LaCroix, Sioux Lookout, our localized areas. So we travel wherever the need is, which accumulates to about 100 days in a year, which are dental days, we call them. And then we also provide hygiene care as well on the mobile dental office.
And you'd mentioned earlier on the show that there is new funding from the province of Ontario that you will be getting another mobile dental unit as well.
Yes.
To help service the increased demand.
Exactly. So we'll have 2 buses actually circulating in around the area. And I'm always intrigued because really it's a billboard on wheels. So we don't really, we do some, you know, marketing to let people know that we're coming to the area, but really essentially you just see this big bus go by with big smiling children on there. So really we'll be going to where the need is. So I'm forecasting, like I had said earlier, that if we have some areas where there's a need, where there's a large number of seniors located, we will go there. The accessibility piece is a really important piece to talk about, because in long-term facilities, it's a real undertaking for families and also support workers to have some of their residents be taken out of the long-term facilities for different ailments, different issues. You know, some may suffer with dementia or Alzheimer's, and what happens is that's very confusing. And so essentially they're still going to be close to their comforts of where they're staying, but will be parked right outside. So, you know, there's not that need to try to align all of the different people to get into an actual dental office. We're going to come right to them and help them provide care. So there's some people that, you know, are suffering with dental disease that haven't been able to access care. So, you know, we're hoping to help them with that.
So stay tuned and watch for, what color is it?
Well, the one right now is actually our branded colors that people, I'm hoping, are familiar with, and it has 2 smiling children. So now that we're expanding our program to include seniors, maybe there's going to be maybe some senior images on there. I'm not quite sure. We haven't got that far yet. We're just actually working out the smaller details of what we're going to have on the bus, and we're kind of going to use our experience from what we had with our bus that we currently operate, and we've implemented some new things in there, and then we're also going to rebrand it so then people will recognize, okay, that goes with that, and now there's 2 running around.
That's going to be great. I
Yes.
think it's so important that people have access to the services that they need.
Well, I think that our community is really fortunate to have that infrastructure in place, because some communities don't have that. So just being able to have a mobile bus come in and provide service, and dental service, which is so important and is often for families that can't afford dental work, that now they can come and access care and get that done.
So now you've got it covered at the younger ages, and also with this new program, the services will be provided for seniors who maybe couldn't access the service in the past.
Exactly. You know, it makes me kind of smile, because we were talking about our history, my history of being involved in the Northwestern Health Unit, and how I've been here for 13 years. So it's funny, when I first started, I had very young children, so I could really connect with families that were with young children. And now that I'm aging, I guess, alongside of my parents, now I get that piece and that perspective, and now I'm able to help people as I would be helping my parents. So it's really interesting from one end to the other now. So it's pretty exciting. And you know, families are so thankful for us being able to provide service, you know, and that is probably one of the most rewarding things.
A lot of people, sometimes you hear, oh, I'm afraid to go to the dentist, or there's anxiety around it.
Absolutely.
Do you have any suggestions or tips for people that maybe you could share to help them overcome that?
Well, you know, we hear so many stories, and now that we're servicing the senior population, there's stories about there, and you know, we have to kind of bring them back to, we're not the train that traveled through the community. There's a lot of seniors that remember that, and you know, it was primarily extractions, and some remember that maybe they didn't have enough freezing or what have you, and you know, there is a genuine fear. And what I always encourage people to do, be honest about it and just tell the dentist, you know what, I'm really scared, and that is okay. I don't really like it either. I'm always thinking, oh, if I have to get freezing. But once you get it, it's like, oh, it's not bad. And things have improved so much over the years, and it's just really communication. And we're there to help. And so, you know, I really pride our dental team on being very compassionate, and we will do whatever it takes to help these families to overcome the fear of dentistry.
Anything else you'd like to add about the new program? Because it is new, it is starting to roll out, and eventually it will catch momentum. So
Yes.
Do you anticipate that the numbers, as the word gets out, will increase and you'll start seeing more of a demand over time?
Well, and I think that's like everything, right? Because I think if you have a good experience, many of the same people will say, oh, I accessed this program and it was so good. And because sometimes you think, oh, that's not for me, I would never qualify. And I always encourage families, even if you don't think, and I say families because, there's people that are independent, but there's also families in the senior population that really require the support from their family and their loved ones, or even, it could be any type of partners. So I always encourage people to call us and we will help you through the process. What's the worst thing? They say, no, you don't qualify. Mm-hmm. But you know what? We're willing to help, and that's our job, and that's what we want to do.
And so you're making it as easy as possible for people.
Absolutely, yeah.
You're only a phone call away.
That's exactly it.
And we will post the numbers at the end of the show so that people can access the information.
Mm-hmm.
Is there anything else you'd like to add about the program that you feel is important for the viewers to know? We've covered a lot of material.
Yes. I just think that, don't overlook the importance of oral health, because really, as we age, we need to keep our body nourished, our bodies healthy, so then we can be healthy enough for any type of illness that comes through. So, I think that you have to take your oral health as an important piece and really get yourself out there. Call us, we'll help you. That's really essentially the big piece of this all.
If you have dentures,
yes,
and you have full dentures, should
yes,
you still go for checkups?
Well, sure, you can. You can come onto our mobile dental office. Over time, I was just actually providing service in Pickle Lake, and we had 2 seniors that enrolled. And they were like, well, we just went to the dentist, and we encouraged them they qualified. So we encouraged them to come and get a checkup. And you know what? We were able to help them with things that they didn't even realize that was something that they thought everything was fine. And we were able to help them. And I'm proud to say that they were so thankful for the care that they received. We've brought them together there into respect to partners that can help them. And they've gotten the whole piece of dental care. So.
That's a great story to end on, Silvana, and I want to thank you so much for coming and helping us learn more about the Ontario program to help seniors with low income so that they can take care of their dental health.
I'm only a call away, so anybody that needs help, I'm more than happy to help.
That's great. That's our show for today. Just remember, if you have any questions about the program, please don't hesitate to pick up the phone and call your local Northwestern Health Unit. We will post the number at the end of the show. That's it for this week. Stay tuned for our next show. Bye for now.